Hi, my name's Dr. Karina Patel, and I'm the director of the TMJ and Sleep Therapy Centre of London. We're currently based out of the London Sleep Centre on Harley Street in the UK. I'm going to talk about myofunctional therapy, what it is, and how it works. Myofunctional therapy is the neuromuscular re-education of the orofacial muscles. This includes the face, the tongue, and exercise and behaviour modification techniques are used to promote proper tongue position. Myofunctional disorders are those in which incorrect use of muscles affects many things, including breastfeeding, chewing, swallowing, speech, occlusion, TMJ movement, oral hygiene, orthodontic stability, and also facial aesthetics. In patients that mouth breathe, we can see that over and underuse of certain muscles can hinder the treatment of dental conditions. Muscles must work in harmony. Proper function is primarily determined by the tongue posture. Normal tongue posture is when the tip of the tongue is firmly against the roof of the mouth, behind the upper front teeth. This is a starting point that allows other muscles to function normally. Now, we all swallow between 500 and 1,000 times a day, so it's very important, but it's also the tongue position at rest which affects function too. Incorrect swallowing can cause dental problems. For example, when the tongue pushes between the teeth, the constant pressure results in movement of the teeth, and it can also stop the eruption of new teeth. This condition is known as a tongue thrust. Our tongues are one of the strongest muscles in our body. It only takes 10 to 15 grams of force to move a tooth, but the tongue is able to exert about 500 grams of force at any given time. Therefore, it can not only affect tooth alignment, but also chewing, swallowing, and digestion. We also see cosmetic problems that can happen as a result of improper tongue function. This includes full, weak lips and constantly parted lips. Incorrect swallowing can also lead to something called facial grimace, where a patient presents with pursed tight lips, chin, and cheeks. Speech and articulation of sounds can also be affected by improper muscle function, for example, when a patient presents with a lisp. Now moving on to the airway. So, airway obstruction, including snoring, sleep-disordered breathing, and also sleep apnea, respiratory disorders, can also cause incorrect muscle function, or the muscle function can cause the medical problems. Having enlarged tonsils or adenoids or being prone to allergies can also cause inflammation and obstruction of the airway, resulting in these as well. So when this happens, we have incorrect tongue posture due to habitual mouth breathing. Being tongue-tied can also cause a problem. This is where the frenum or attachment from the tongue to the floor of the mouth can also restrict proper function. Other things, like thumb sucking, also cause a problem. Thumb sucking can push the tongue into an abnormal position, leading to, again, improper functional patterns. This lack of equilibrium over time can cause collapse of the dental arch. And habits are very hard to break, but myofunctional therapy has helped many people of all ages, from young children to adults, break their dysfunctional habits. Myofunctional therapy is pain-free and simple. The biggest factor that is essential for success is the daily exercises are done with commitment and 100% compliance. The treatment usually lasts between 4 to 12 months, and the exercises are based on individual customized programs. This therapy not only will bring back your normal tongue function and muscle function in the head and neck, but it will also help retain things like orthodontic treatment. It will help to strengthen the airway muscles to help with other problems like snoring, sleep-disordered breathing, and sleep apnea. A multidisciplinary approach is key to success. Now, myofunctional therapy is not only carried out by people in the dental profession or speech and language pathologists. However, it is these professionals that might be best suited to help you. The reason being is because of the extensive knowledge in the head and neck area. So where can you actually find these professionals? There's multiple different avenues that you can explore. There's different academies and societies all throughout the world. Now, the TMJ and Sleep Therapy Centres International are trained to screen for these problems, and they might actually be trained as myofunctional therapists themselves. So you can always come to one of us. Other than that, there are different institutes, as I said, throughout the world that might be able to help you. So I hope that was informative, and thank you for listening.